Hi everyone, this is Karthik from Caapid Simplified, and we're finally releasing our first video in 2021. So welcome back everyone, and it's an absolute pleasure to meet you ahead of two very important interviews, Colorado, in May and in June. We trained about, I think, 7 candidates for the April Colorado interviews, and as you expected, all 7 got through to the virtual bench interview. We're super excited, and we hope this trend again continues for May and for June. From the experience coaching them, I want to share a couple of tips that you can take into your preparation and execution at the Colorado interviews in the next 2 months. The first couple of tips are going to focus on Zoom interviews. The next couple of tips are going to speak about how you should overall manage the interview. And the third and final set of tips will be around specific questions that Colorado has been asking this cycle, which we did not hear about last cycle. Having said that, let's dive into the 3 sections. Section number 1, how do you tackle Zoom interviews? As you might be already knowing, Colorado has a panel interview, and one of the panelists can be a student. So that would put 4 people and you on this very same screen. You are asked to use a gallery view rather than a speaker view so that you can see everybody's faces. However, an interviewer will not know if you have it in a speaker mode or in a gallery mode when you have changed it at your end. Why am I suggesting this? The reason is, if you have it in speaker mode, you can switch it, or you can tag or pin a particular person whose face is most pleasing to you. By connecting with that face and speaking to that interviewer's face, you are kind of negating the opportunity of other dull faces making your interview experience poor. Once you've done that and gone into speaker mode, you're speaking to one person, you can also minimize the screen from full screen mode to half screen to make sure that that person's face comes closer to your laptop camera. While no interviewer has ever suggested that your eyes should make contact with the camera, the closer it is to the camera, it makes a much better impression in terms of staying engaged with the interviewer. A lot of us have the problem of thinking in between our answers. And when we think in between our answers, what happens is our eyes start drifting upwards. So even though the laptop is in front of us, we keep watching the ceiling and then we speak. One way to negate this is by sticking something on your ceiling, which I have done, that says look down. So the minute I start observing up, trying to think of my answers, I look at the note and then I come back down to watch the interviewer and think while looking at him. The easy way to think, and if you can train yourself pretty hard, is to fold your toes. Try that with me. Fold your toes and think. If you fold your toes and put your focus over there while thinking of an answer, you will not look up at the ceiling, and therefore it will create this artificial sense of engagement with the interviewer. I've given you a couple of tips. Let's go to a few more. In Zoom, the biggest problem that people face is not video. Video can stammer, video can stagnate, the video can get stuck, but that has never caused a displeasing experience. The real power of video is the quality of your audio. So please focus, and maybe even in the next couple of days, invest on a lavalier mic from Amazon and use that in your conversation. It's better to use, sometimes if you have a Mac, the Mac's own mic and speaker, rather than using a headphone or earphone in between, because the Mac's very speaker and mic are very powerful and you can rely on that. You also have the option of dialing in from your phone to a Zoom call. So you can dial in from your phone and speak from your phone's mic if your laptop is not an Apple one. So I have a Lenovo laptop and I have an Apple phone. My Apple phone's mic is extremely powerful, so I dial into my Zoom calls, use my phone for audio, but then use my laptop for video. You have this option and you can exercise it. There are a couple of more tips I'm going to tell you. Take sticky notes. And if a sticky note is square in shape, you will notice that only at the top of the sticky note is the actual sticky portion, meaning the adhesive is at the top. Cut the adhesive part out, and then on the adhesive part, write a tip to remind you something in the interview. Stick this adhesive note next to the camera on your laptop screen. Now, what does this do? Some of the most critical things that we want to say in an interview, we get stuck and we do not say. But this note will remind you what you want to say, and then you can actually share it. The few words that I like to write on my sticky notes when I go into an interview are things like talk slow, be succinct, remember to summarize, stop giving ahs, stuff like that. Things that would basically be showstoppers or make a very good answer sound really dull. I would take these ideas, put them on this adhesive portion of the sticky note, and then stick them on the laptop. Now, while I'm looking at the camera, even if my eyes waver a bit, it will not at all be seen. And proof for this is news channels. If you see news channels, actually everybody in the news channel is reading out of a teleprompter, meaning their eyes need to shift left and right as they keep reading, but you will never notice that as a viewer. The reason this happens is our eyes move so fast in reading in a short space that the camera is unable to capture that fast movement. So it looks like your eyes are in the same place, and yet you have this illusion of engaging with the audience without actually looking at them. So these are a couple of tips. We're talking about sticky notes, we're talking about the importance of audio. We've spoken about the ideas to look up, stick a paper up when you're thinking to give this artificial illusion, and most importantly, engaging with a pleasant face rather than engaging with everybody in the interview. Now, having said all of that, let's switch to a different topic, which is the topic of how do you really nail CU interviews? I'm pretty sure that you might have watched the videos that we have posted by interviewing past candidates, alumni of Caapid Simplified on our channel. And while these videos are over an hour in length because they were webinars, some insights that we have seen are consistent and very applicable are: number one, the most important thing that makes you get into CU is being personable. Number two, the other important thing that gets you into CU is staying yourself. Number three, it is highly likely that people will forget you unless you give them an opportunity to know, for them to remember who you are. Now let's see what these three big concepts are. The first concept is being personable. And what does that mean? That means Colorado appreciates you having a conversation, a casual one, and being yourself while speaking to the interviewer. Trying to force fit jargon, trying to speak really fast to cover a lot of ground, and trying to artificially make your experience more than it actually is may not be a good strategy. What you might rather want to speak about is how did you deal with the patient? What were the emotions that went through that process? Why did something feel very impactful or very unreliable in a certain point in your time? So speak about you as a normal human being, your pains, your pleasures, the things that inspire you, the things that make you guilty. These are the things that they can connect with, because these are the things that would matter in a conversation with the same faculty at the pizza shop outside the school. If you're able to have an equally comfortable conversation in your suit inside the interview room on Zoom, then that is what they mean by a conversation. Do not try to make a very powerful professional pitch just because you're sitting in a suit in front of a laptop. Be extremely comfortable. If you can, laugh at yourself, be vulnerable. It's okay to convey your mistakes. It's okay to say that you're wrong. It's okay to admit that you were guilty. It's completely fine, because that's how a conversation in real life will proceed. The next idea was being yourself. When Nourah went to her CU interview back in 2019, she did not make it through. And the feedback that she got via mail was, you were not yourself. In fact, it also came with the line saying, we believe you're not coachable. Now, what is this coachability and adaptability and being yourself? Obviously, in front of a camera, you are being yourself. Then what's happening? The problem is, in our attempts to speak out rehearsed answers, to deliver all the content that we prepared prior to the interview, and to make sure that we do not leave the interviewer with disappointment, we tend to overdo things. We tend to not just talk about ourselves, but overcompensate for our experiences. Now, what is the difference between somebody overcompensating and somebody being themselves? So let's assume they're asking you about your undergraduate experience. If you were to say, I've had significant amount of community service experience, I've done a lot of paper presentations, I've been the college topper. In BDS, I was recognized by my professor, who also called me to intern with him at his own practice. I've done 32 root canals while in the final year rotation as a house surgeon, so on and so forth. That feels like you are trying to almost reinterpret the resume and share it back to the interviewer. Instead, what if you put the answer like this? My undergraduate education was really funny. I actually went into dentistry initially thinking that it would be a completely different school, only to be surprised that in my very first year, I would actually share the same classroom as those people trying to become physicians. I did never realize that I would have to learn human biology and anatomy, and upon those foundations only start specializing on what I thought were teeth. Today, as I reflect on my past, I understand that teeth is just the most visible aesthetic structure in dentistry. There's a whole ecosystem behind it. And unless you protect this ecosystem like periodontists do, you cannot really make a difference in this sole aesthetic structure. This is how I see my undergraduate education. I see my faculty, my friends, my curriculum, my opportunities in community service, and even research opportunities as the environment that supports me, the tooth, to shine to an outside group. Can you see how I put it differently? By connecting this to an anecdote, by giving an example, by speaking about something I felt rather than something I did, I can make a significant difference in the person listening to me for a CU interview. The last option, the last thing I mentioned was being coachable or adaptable. Now, what does that mean? That means rather than finishing your sentence by saying, I did this, I have 10 years of experience, you finish it by saying, I have 10 years of experience, and that gives me the right tool set and mindset to continuously learn and learn at your school. So you are using your past experience not as a burden, not as a strength, but as a leverage that pushes you and inspires you to learn further. Remember, the key is being capable at adaptation. The key is being open to coaching. The key is seeking and receiving mentorship at any age and any amount of experience. So do not place yourself as the best in dentistry. Say that having achieved these things makes you fertile ground to learn even further, right? Project yourself as not as destination, but project yourself as a very, very strong launch pad. Okay, the third concept I almost forgot. Was it okay, let's skip that for now. It's out of my head. Now, the third set of tips is about CU answers. When it comes to CU answers, we already spoke about having a conversation, being yourself, trying to demonstrate you're coachable and adaptable. Apart from these, you will have to try to connect a couple of dots. Now, what are these dots? Colorado University has very homogeneous candidates amongst its international dental pool. So out of the 40 students who get in every year, you might see a good number of them are from maybe 1 or 2 Asian countries. There are few candidates who come from other countries. Therefore, it is highly important that you differentiate your story, not because of your credentials or experience, but because of what you've learned from your experiences or credentials. Each of us would have been a dental assistant. Each of us could have gone to dental school. Each of us might have been in multiple community service experiences. Each of us might have all done research. But what do we take away from that? Don't just say, I did MPH. Say what you learned from MPH. Like this, create for yourself 6 stories. If you know, one of our coaches, Kripa, on the Caapid Simplified platform, helps people craft 6 stories about themselves. Craft 6 specific stories that make your pitch, your interview sound extremely different. I'll give you an example of one pitch that I have, and this is a story I will always pull out and share no matter what the question is. So this is what the story goes like. While I was working as a dental assistant, I saw another dentist come through who was recently graduated from DDS and was practicing. I was asked to assist her. Now, naturally, I have more experience working back in India, and I also have been practicing as a dentist, making me more skilled and more experienced at this. So when the local dentist started treating the patient, I noticed she was doing something wrong. I immediately called her out by saying, "Hey, that's not right. Let's talk about this." And she was like, it's okay. We've discussed this with the patient." And I'm like, no, I don't think it's right. Let me show you. And I took her aside. The mistake that I did was I did not realize that there was a certain treatment protocol to actually not give the best option, that is not go for a root canal, but instead go for an extraction. And that was the treatment protocol that patient had signed up to while discussing the treatment plan with her in a previous counseling session. Unaware of this, I had accidentally judged the dentist I was working with and said that she was doing a mistake. It was my preconceived notions because of my experience that I started judging somebody with lesser experience rather than giving them the benefit of doubt and respecting them for their education. This was a mistake I did in the past, and this is a mistake I have recovered from. You get it, right? In this example, I'm trying to talk about feeling guilty about doing something wrong and using that as a way to pitch how I am adaptable and coachable and open to working with people less experienced than me. Also, I demonstrated my understanding of how treatment plans can vary, may not give the best standard of care based on insurance constraints in the US healthcare system. So, like this, if you can develop 6 solid stories, then you can answer the questions for CU no matter what they are, whether it is why CU, why you, tell me about yourself, what is your learning process, how do you face a challenge, tell me about a time you failed, whatever may be the question, you will be in a really good spot. The one question that I've been hearing more recently in CU is this idea of learning process or learning curve. Now, what does that mean? Now, in a typical factory scenario, if you were to run a factory and let's say you're making a bunch of dental aligners with the 3D printing machines, the first time you make the dental aligner, it might take a lot of time, maybe 1.5 years. The second time, it might take 1 year. The third time, it will come down to 1 week. But then at one point, you'll hit steady state. You will be able to create an aligner from design all the way to fabrication within a 1 week time frame. As you progress, slowly from this 1 week, it starts reducing to 5 days, to 4.5 days, to 4.2 days, and so on. So the progression of your learning over time to actually give you efficiency is called a learning curve. Why does CU want to know what your learning curve is? Because they expect that you as an international dentist do not have a lot of idea about US clinical dentistry, about office management, about patient interaction, so on and so forth. And they want to know if they were to stuff so many things down your throat all of a sudden in 2 years, are you able to pick it all up, excel, and come out on the top? Try to speak about one scenario in your life where you have had to swallow a lot in terms of learning something new and using that to apply it in a real world scenario. If you can give one example that speaks about your learning curve in the past, that is, how you learned a lot of information in a short amount of time, you will be in an extremely comfortable position to rock this interview. All right, guys, we're happy to discuss a lot of things around CU. If you've watched this video till the end, feel free to give us a call and ask us more questions and discuss answers. Just for open calls, we do not charge money. It's a non-profit organization. Only for coaching do we charge and use that to give scholarships back to dentists. Having said all of this, I'm going to bid adieu. Karthik from Caapid Simplified.